So there recently has been a death at a long-term care home that had tested positive, and we understand now it's a false positive. Can you tell us what happened?
Well, my first comments would be condolences to the family and to the care providers of this individual. We initially received a positive test from Public Health Ontario, which upon review was a very weak positive test that was done around the time of the death of this individual. We clearly would treat that very seriously and did a thorough investigation. Our investigation would include, in partnership with Arbor Heights, testing of all the individuals that were providing care to this person, family members, as well as all patients' clients on the ward where this patient was receiving care. We also reviewed the medical history of the individual and whether they've been to hospital recently or what personal protective equipment was used or precautions were taken around this individual. We are confident now in having reviewed the clinical care provided that all personal protective equipment was appropriately used, that the patient had not been to hospital recently, that the patient had been in isolation for many, many weeks, and all appropriate precautions were taken to protect this individual against COVID-19. The patient had multiple medical illnesses and had no new symptoms associated with COVID-19. Public Health Ontario informed us this morning that they repeated the test, given that it was a low positive, and that in their new test of this revealed no evidence of the virus. So we have to put the laboratory test and all of that additional information we acquired into context. And now, in the light of day and our investigation, with that additional information, we're confident that this person did not die of COVID-19, but died of their other medical illnesses. We've communicated this back to the attending physician and the staff and have informed the family of our conclusion of this investigation. We will be informing the province as well, as this case was under investigation and may have been put on the Ontario website as an associated death with COVID-19. In our conclusion now, that is not the case, and we'll be informing the province later today.